Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you back as I highlight an important paper from the June 2022 edition of the Journal of Rheumatology. Today, I will be speaking with Ms. Jennifer Weinstein and Ms. Lynne Matallana, who are two of the authors of our featured article titled Patient-Reported Impact of Symptoms in Fibromyalgia, PRISM-FM. I want to thank you both for taking the time to talk to me and to our listeners on behalf of all the authors of your paper. And we should hopefully have a nice discussion about the findings of your paper. So without further ado, shall we begin? Sound good? Okay.
Great.
So what were the aims of your study?
So essentially, our research objective was to use direct patient input to determine the prevalence and impact of the varied symptoms and issues that occur in fibromyalgia. As we all know, it's a widely misunderstood disorder. It's highly stigmatized and invisible, and it really requires additional research to better understand the complexities of this disorder and develop effective therapeutics. So our first specific aim was to conduct semi-structured qualitative interviews with individuals ages 18 and older with fibromyalgia. And then based upon the quotes that we obtained from those individuals, develop a national cross-sectional survey that would essentially serve to validate these symptoms among a larger population of individuals with fibromyalgia.
Lynn, anything you want to add?
I would just like to add that I was extremely excited about this study. As the founder and president of the National Fibromyalgia Association for over 28 years, and going on this journey for so long, working with researchers and hoping that we will eventually not be able to say misunderstood disorder, that we will better understand it. And I did feel this study was going to be very important because the amount of research that's been done recently has really declined. And when the university came to the NFA asking us if we would want to partner, I was thrilled because they were focusing on the impact of the symptoms and the experience of living with fibromyalgia. And that's something that hadn't been really done before. So to me, to be able to have an opportunity to bring a large group of patients to them so that they could have a really, strong group of people and a diverse group of people to be a part of their study. So from our standpoint, hoping that this would provide outcomes, which it has, that we'll be able to share with and hopefully encourage both healthcare providers as well as researchers to get more involved in the process of looking at how this does impact patients. And also it helps us to understand how it impacts families, our medical system, and even our disability system and others. So I'm thrilled with the work that they have done and that we got to be a small part of it.
Thank you. That's great. Yeah, it certainly is a big issue, both as primary and certainly secondary to many rheumatic diseases. And in some people, in fact, it is a greater impact on their life than their primary rheumatic disease. So it is important. I'm sorry, Jennifer, were you going to say something?
No, I just was going to add that, one of the greatest limiting factors in clinical research is participant enrollment. And so when we look to develop our patient or caregiver reported outcome measures, which is this paper represents the first two steps in that process. I learned about Lynne and the National Fibromyalgia Association, and it was clear that, you know, her competence, connection, and character definitely established her organization as the leader to many people affected by fibromyalgia. And so it's really by virtue of her work assisting with our recruitment that we were able to obtain these results.
That sounds like a perfect marriage, if there's such a thing.
Absolutely. And I have to thank the fibromyalgia community. They have done so many research studies and surveys and really have gotten up out of bed. And you know, as Jennifer knows, we were trying to get a diverse group of people. And sometimes it's hard to get those people that are the sickest because, you know, it does take quite a bit for the patients to be a part of something like this. And I always like to put in an extra thank you to them, because without them doing this, we aren't going to be able to help them. So it is a partnership with them as well.
Perfect. So how was the study performed? How'd you recruit people, et cetera, et cetera?
So as I mentioned, our first specific aim was to conduct the semi-structured qualitative interviews with individuals who have fibromyalgia. And so the National Fibromyalgia Association helped in identifying our sample, a diverse sample that would be representative of the population in their registry. And when speaking with these individuals, we simply asked them to talk about all the symptoms and the ways that their life is impacted by fibromyalgia. So following that process, in those interviews conducted with 15 adults with fibromyalgia, we achieved saturation. And we transcribed, analyzed, coded and analyzed all of the quotes. And essentially the quotes that were most commonly stated were then used in assembling our national cross-sectional survey, which we then distributed again through the National Fibromyalgia Association. It was implemented online via REDCap. And we had an amazing response from their organization in terms of providing the data that we were seeking.
Anything you want to add, Lynne?
One of the things that the NFA has done has really focused on research. And this was a challenging task, I have to say, because we wanted to make sure that we had more diversity, and we wanted to make sure that we reached a large number of people because we saw, you know, such great importance of doing this study. So I just feel like it was really exciting to be able to tell patients they are focusing on what this does to you, what this illness has an effect on you. And that's something they don't get to share, or if they do, they're told they're complaining or they're, you know, drug seeking or whatever. And this gave them a chance to really share what they were experiencing and how difficult it is. And I think one of the things that's so hard right now is that there are very few doctors that are even willing to treat people with fibromyalgia because they don't have the knowledge and they don't have the tools. And I think it frustrates the doctors. And we need to start with the research to be able to look at so many outcomes that really give us information on, are we doing the right thing in our approach to creating treatments? This study.
Right. So move on. So what were the findings? Now the perfect setup of the first part, the semi-structured interviews.
Yeah, so there was a great deal of commonality from all the participants of this first phase of our research. We obtained and analyzed almost 1,500 direct individual quotes that were all symptoms of importance to this population. And as you would expect, the symptomatic theme that was commented on the most dealt with pain, and a broad selection of items regarding the pain. For example, the effects of weather upon pain, the locations of pain, the unpredictability of the pain, its debilitating nature. So it really, pain itself is a component that has a lot of factors within it. A second common theme were challenges in emotional health and cognitive functioning. A third source would be challenges associated with activities of daily living, simply not being as independent as they were or would like to be, reliance upon others for assistance. And then I would say another component that was mentioned extensively were issues regarding sleep, just whether it's disrupted sleep, inability to fall asleep, pain interfering with sleep. So absolutely, fatigue was something very commonly experienced.
Okay, so
And
go ahead.
these symptoms, it's really interesting because different studies have shown different kind of an order of how these symptoms affect people. Pain definitely seems to be one of the top things, but as Jennifer said, fatigue again is something really hard to be able to help people with. And if you have the fatigue, you just can't get up out of bed. If you just have pain, oftentimes people can, get up and go and do things despite that. But that fatigue and that inability to feel like they can do normal things that you do in life is a huge, huge impact. And I think that's why a lot of patients have now, I call it kind of going into their home and not even seeking out help, not doing things that are going to improve their situation. And I think this is something that I'm excited about, the fact that you're doing this interview and that the article is getting published and that it will bring more attention to the fact that we have to focus on getting these patients to even believe that there are people that believe in them and that they're willing to do studies like this, and that the study is not just doing the study, but taking those results and sharing them with medical experts and other researchers, and really getting the attention to this problem, and then getting the patients to believe that there are people who really care and really are going to try to figure out ways to come up with better treatments.
I just want to throw something in for those in case you didn't know, but I'm sure you do. For the longest time, the journal, one of the prominent people in the journal was Dr. Hugh Smythe, who certainly did a lot of research into fibromyalgia, and I think did bring it known to the world, was one of the important people bringing it into the forefront and saying it's real.
Absolutely.
Unfortunately, I'm not convinced we're that much further in helping people than from the 80s. I hate to say that, but I hope we can.
It breaks my heart because I do agree with you. And I think that one of the other reasons why we were excited of working with Jennifer and her group was because we're a neurological department.
Right.
And I remember the days when you would walk into a group of doctors that were neurologists who would look at you and laugh at you practically. And it was exciting to know that it wasn't just going to be rheumatologists, but also we had, a little bit of a different perspective coming in, and that there are new people. I now hear from patients that more of them are seeing neurologists. And so opening up this group of people to additional, health practices is really important, because I think we'll get a better understanding. And so, yes, there's quite a few doctors that I feel were amazing. Dan Claw, who is still working daily, trying to help people understand. And I sometimes don't want us to say that we don't understand fibromyalgia, because there was and has been a lot of work on, the central nervous system and some of the issues of, pain amplification that we do understand. It's just trying to make it fit into the paradigm of our medical system, and sometimes that doesn't work. So I'm hoping that this study will get people's attention.
Yeah, I
Yeah, go ahead.
also I did want to point out, and I know Dr. Claude published an article on this recently, but with the clinical commonality between long COVID and fibromyalgia, I do think there is hope that more research will be conducted in the near future. And I think that, long COVID has given many people who perhaps had doubted the legitimacy of a fibromyalgia diagnosis, the validation that it deserves, that there can be, invisible illness that greatly, it really disrupts a person's life and ability to do work, get out of bed, do all the things of normal everyday life. So
it's interesting because that you brought that up, because we are hearing more from people who say, I've been diagnosed with long COVID and I've been told it's really fibromyalgia, and I don't want that diagnosis. And so, I think there's a lot of education that needs to be done, and more research, of course.
Maybe we should change the name. People will be happier. Long COVID-like illness. How's that? So that leads us into the second part of the study. And I think you addressed who was studied and where we identified the. So what themes then were identified in the second part of this? I'm sorry, what questions did you ask first? And then what did you discover?
Right. So the methodology that we use to when we do our disease-specific studies are asking essentially the same question, which is, how much does the following impact your life now? And so the fibromyalgia survey contained 149 symptoms that were part of 14 symptomatic themes. And so the participants are provided with a 6-point Likert scale, where they may respond, they do not experience it, they do experience it, it impacts their life a little bit, it affects their life a little, it affects their life moderately, it affects it very much, or it affects my life severely. And so that is the way in which we generate an impact metric that we use throughout our research. So as I said, we had an amazing response from the National Fibromyalgia Association. We had 1,085 participants in this cross-sectional survey. And essentially, they provided over 172,000 questions, answers to questions regarding these symptoms. So a great amount of data. And essentially, what we then do is we like to perform subgroup analysis to really understand which groups of people are more affected by the disease. And so we do the subgroup analyses by different clinical or demographic characteristics.
Okay. So leads into the obvious next question. So what were the findings and what common themes were identified? And then we'll get to what you said, how you subdivided them.
Yeah, so the symptomatic themes with the highest prevalence were pain, muscle tenderness, and fatigue. And then within that, the individual symptoms with the highest prevalence were decreased energy, sore or achy muscles, and tired muscles. And then if you look at those symptomatic themes with the highest impact, we had fatigue, impaired sleep and daytime sleepiness, and muscle tenderness. So there's a lot of commonality between the prevalence and the impact. It definitely, in comparison to other studies we've conducted, the rate of prevalence of these symptoms were dramatically higher than many other diseases that we have examined. So just a lot of commonality among what people are experiencing.
Yeah, many ways, the findings of the study, having dealt with patients with fibromyalgia for many, weren't surprising, but it validates what we think are the issues. But it's very important to see this commonality. It's one thing to say, oh, eminence-based, as opposed to, in this case, it's evidence-based. So I think
Yes.
from the people themselves, and I think that's really important. So one thing that strikes you, or age, was there effect of age and or symptom duration? So if you had it longer, did that affect your findings? And did age groupings?
Yeah, so in terms of age, the only finding that we had was that participants who were younger than the median age of 59 years were more likely to suffer from headaches and difficulty thinking than those who were older than the median age, which is a little counterintuitive.
Yeah.
And then the second finding was that those who had a duration of disease less than the median of 40 years were also more likely to have headaches than those people with a duration that was greater than the mean. So those were kind of the two age and symptom duration related findings. In general, we had findings that that employment status change due to one's fibromyalgia was associated with a higher disease burden. And there were, I think it was nearly 70% of participants indicated that they had experienced some kind of employment status change that was directly attributable to the fibromyalgia, which is pretty significant. Another interesting finding is that the individuals who reported that they believe the origin of their fibromyalgia was due to trauma, whether physical or emotional, they indicated a much higher prevalence of symptoms than those who did not attribute the onset of their fibromyalgia to trauma. Missed work due to fibromyalgia was associated with greater disease burden, as was level of disability measured by the modified Rankin scale. So, those were kind of the fundamental findings from the subgroup analysis. What I found to be just very compelling was that over 60% of the participants in this study had been experiencing their symptoms for more than 20 years. And I mean, to me, that just indicates such a depth of knowledge about all the different symptoms and how, it does impact their life. These are people who've been dealing with this disorder for so many years now. And I just was, really impacted by that in terms of the results that we received.
It's very interesting that if the duration didn't seem to matter that much. And whether you had it for, we'll say, less than 20 years or 10 years or 5 years, that it was still the same, that you felt the disease, well, the disease impacted people's lives in almost identical ways or similar ways, at least, which is fascinating, that there's no adaptation or change over time, at least as I see it. So
No, and oh, sorry.
I was just going to say, I think that the reason why is because there has been little education and help to guide people into a process of figuring out how to either live better with this illness or else find the right type of help that works for them. We find people with fibromyalgia, and I know this study showed that there are so many different symptoms and ways that it impacts people's lives. And so it's hard to kind of grasp it all and pull it all into something that people would say, okay, here's the plan, this is what you do. And so I think that that was a huge outcome from this. And I think that there are different ways maybe that we need to look at the treatments because of what we're finding the impacts are. I think maybe, we need to do some shifting and looking at, are drugs the right way? Is a holistic approach better? Is integrative, treatment, or is self-care the way to go? So I think that this is opening up our eyes to, we're not addressing those needs, and we need to do that. From the study, I was so interested in a couple of things. One was that it was just over 50% that said that they felt that the onset was from trauma. And I would have thought that that number would have been much higher, because usually we hear from people who have had either an emotional or a physical trauma. So I think that was really interesting and should be looked at a lot more. The other area I was interested in was, I felt that the level of disability, or the number of people on disability, was fairly low, but the number of people who were impacted in their life and their ability to work was fairly high. And I know that's because a lot of people either choose not to try to get disability or aren't given disability. And so I think this is something else that we really need to help people. Kind of the quote is, get their life back, so that they can get back to work. And I think the reason why a lot of people don't go on disability is they have hope that they will get better. And so, but they need additional treatments and additional things that really work to get them to that point.
Great. Excellent. So that leads into, did any of the treatments alter your findings? We were just discussing what people do, and did you find that it seemed to matter?
Yeah, a key inquiry that we made in our research was looking at the effectiveness of medication and therapy. And we did not discover the use of medication, did not reveal any associations with, improved, lessened disease burden. The only thing that we found with regard to medication was that the use of antidepressants was associated with increases in difficulty thinking, which can be a common side effect. With regard to therapy, we had the data indicated an association between those who use aquatherapy and a higher prevalence of limitations with mobility and walking, and decreased performance in social situations. And perhaps those who are pursuing aquatherapy have a higher level of difficulty with mobility and walking to begin with, and that's the reason why they're seeking aquatherapy over other kinds of physical therapy. So that merits a little bit more understanding to really know why exactly. In terms of other therapies, there was no association shown for acupuncture or the myofascial release therapy. So I would have to say that in terms of the effectiveness overall of medication and various therapies, it really did not seem to be associated with a lessened disease burden.
That was really interesting because, there's been a lot of research on acupuncture, and that has been thought to be something that was helpful. And so this group of people obviously didn't feel that way. So I think that that's really interesting. I also thought the aquatherapy was interesting because I know that a lot of people have said, and anecdotally in my experience, that getting in a warm pool and being able to move was part of helping to activate them so that they could go on to other things. So I'm really interested in learning more about that subset that said, no, it made it worse for them to be able to activate. So I think that that was a really interesting finding.
Yeah, I mean, obviously our results are absolutely not implying causation. And as I said, it could be that those people who struggle more with mobility are drawn to aquatherapy. And that's simply what is being shown by our data.
Right. And it is, in many ways, selection biased also of people who have chronic disease rather than people who may have improved on some of these therapies. Just something to keep in mind, that it doesn't mean that therapies do or don't help some people.
Right. And we find sometimes one therapy may help a person at one point of their journey and not at another. So
right.
That's when, oftentimes when you're just catching them at a certain place in their journey with fibro.
Of course. So brings us into the hardest question sometimes. All studies have some limitations. So what do you think are important for our listeners to know with this regarding this study?
As with most research, our sample was on average had higher education levels. Our sample was also 95% female, which is a bit higher than what the clinical population of people with fibromyalgia. As with research conducted online, there always is the risk of excluding those people who are not able to participate in online surveys due to technical or socioeconomic factors. So those are all limitations with our research, but I do want to point out that our sample size from at least my review online seemed to exceed most other surveys that have been conducted with fibromyalgia. So, there certainly is some potential for some of the data that we found to perhaps be more reflective of the actual population than what we believe we know.
Of course. No, it was getting over 1,000 people is fantastic. I mean, it does validate your data in a larger population than other people have found. Mm-hmm. So that actually leads me to what should we take away from the study if you could summarize it for those who like this sort of thing?
I'll start off and I'll let Lynne finish here. So I think that just based on what we've discussed so far, people who are dealing with fibromyalgia, they have an incredibly long diagnostic journey, and as well as a long journey of dealing with all of the symptoms. And that has a very compounding effect on their lives, particularly through their ability to work, the financial burden of making repeated visits to physicians and imaging, paying out of pocket for therapy or pain relief medications. There's just a lot of a lot of impacts on the lives of these people. And so we hope, obviously, that this data will help encourage more therapeutic development in those areas and symptoms that the patients have indicated as being the greatest impact on their lives, first and foremost. And obviously, in terms of giving greater legitimacy to this disorder in general, and hopefully reducing the diagnostic journey that so many people have unfortunately had to experience.
Lynne, would you like to add something?
Well, first of all, I just want to thank everyone that was involved with this study. It was a very in-depth study. It was a very long study. I know having more patients to be a part of the research is good, but that also gives you more data to have to analyze and decipher. And I really do hope that that this study will help us to get back on track. I really feel that you know, around 2010 with the economy and the fact that there were, you know, some issues regarding, is medication, you know, of this kind going to be the answer for these people? And I think that just because, excuse me, just because this is a difficult illness, it is a difficult, we're still dealing with the diagnosis and trying to figure that out. We're still trying to figure out how to have treatments that do work. And we're, I think, starting with this study at really defining the problem. And it's not just, you know, the impact on patients, but it's the impact on their family. It's the impact on the medical community and the cost. You know, so many people with fibromyalgia don't even see a doctor anymore. And that can lead to osteoporosis, diabetes, heart disease. I mean, you know, the impacts of not working or walking ends up with, you know, different types of joint replacements. And these things are so costly. And the number of trips to the doctors when you do have these other illnesses that you know, are getting help for is very costly. And then just the cost to society, you know, people not getting to work, not being able to take care of their family, not getting to live life in the quality of life that they want. And I really do believe that I meet thousands and thousands of people with fibromyalgia over the last 28 years. And the one thing I will say is that you know, the very, very few people that don't want to do something to help themselves to get better. It's not a group of people who are lazy or making things up. We've done things where these people are hearing that we believe in their pain and we know that they are struggling and that, you know, the research is showing this, and they almost are in tears because they've gotten to a place where they almost don't believe that their pain is real. And, you know, when you talk about, you know, we have all different numbers, 4 million, 6 million, 10 million, millions of people that are struggling with this. And I really do want to also, you know, not only thank this group of researchers, but the other researchers who are still dealing with this and still trying to make, you know, a way of helping these people. And I do have hope for the future, and I do have hope that we'll get people back on track to look at this more and to find out answers. And so again, I just want to thank you know, Jennifer and her group for doing this.
Is there anything else you'd like to add that maybe we missed? I think we've done a great job. Anything you want to add?
No, I just wanted to add that, as I mentioned previously, this particular manuscript relates to the first 2 phases of our research in developing a patient-reported outcome measure. And we have completed that with, obviously, with the continued assistance in recruitment from the NFA. So it is fully developed, validated, and we hope that this instrument will also serve to bolster clinical trial infrastructure in fibromyalgia and at least lead to being able to demonstrate efficacy of various therapeutics that are developed. We are very hopeful that that work will serve a positive benefit to a lot of these people.
Lynne, anything you want to add?
Well, I guess I just want to add that I know that there are some new medications that are coming out, and they are more specific towards some of the symptoms. I know that there are many medical devices. I also just want to let people know how many years and how much money and time and dedication has gone into trying to help people with fibromyalgia. The NFA for Awareness Day this year did a campaign called You Have Not Been Forgotten. And what we're trying to do is let people know more about this research and about, the medical devices that have been FDA approved. And myself, I'm very involved with a new program for self-care. And we're finding efficacy in being able to personalize and guide self-care to complement the medical system's care. So there's a lot of new things that are coming out, and I just want both the healthcare providers to know maybe they'll have more tools in their toolbox, as well as the patients to know that we hope to have more beneficial treatments and ways to help them.
On that upbeat note, that's great. So I want to thank both of you, Jennifer Weinstein and Lynne Matallana, on behalf of all the authors of their paper, for taking the time to review the findings, implications for now and the future. And to our viewers and listeners, please read the complete paper titled Patient-Reported Impact of Symptoms in Fibromyalgia, PRISM-FM, and an accompanying editorial titled Fibromyalgia and the Difficult Synthesis by Doctors Marco De Carlo, Benedetta Bianchi, and Fausto Salafi. And both of these are available on our website at jroom.org and will be in the June print edition of the journal. And I want to thank the listeners for joining us, and hope you'll come back next month when I will speak again to one of the author or authors of an article that of particular interest from the July 2024 edition of the Journal of Rheumatology. And if you have any comments or questions, I'd love to hear them, either on X at jroom or by email at manuscripts@jroom.com. And again, thank you for listening.